Welcome to Decoding Health, where we uncover the secrets of how your body works, share lifestyle tips, and help you understand your blood work to solve chronic health issues. I'm Dr. Misty Sense, and in each episode, we'll explore a key aspect of your health, empowering you with knowledge to take control of your well-being. Today, we're shining a light on vitamin D3, the sunshine vitamin that you might be missing. So what is vitamin D? Well, it's a fat-soluble vitamin that's essential, meaning your body doesn't make it, so we have to get it from other sources. Now, vitamin D, we all know, helps the body to absorb calcium for healthy bones. But what most don't know is that it does a lot more than that. Vitamin D is produced in the body through sunlight exposure. And when your skin is exposed to UV rays, it triggers a process in your skin cells. And then the skin cells then have to convert the vitamin D from the sun into pre-vitamin D3. But in order to do that, you have to have optimal levels of cholesterol. And then once the vitamin D from the sun gets into the skin, it must be activated. And it has to undergo two transformations, one in the liver and then one in the kidneys. And this makes the active D3 form. Now, there's other things that are needed for your vitamin D3 levels to be at optimum, and these are called cofactors. We need these cofactors to help absorb the vitamin D. So we need things like magnesium, vitamin K, zinc, vitamin A, boron, and omega-3 fatty acids. Vitamin D3 is important for our overall health, not just our bone health. We need vitamin D3 for a strong immune system to be able to fight off infection and reduce inflammation. We need vitamin D for mood regulation and preventing depression and anxiety. Vitamin D levels are also essential for our memory. When we don't have optimal levels of vitamin D3, it can cause early cognitive decline. It's essential for heart health and preventing cardiovascular disease, cancer prevention, muscle function, hormone health. Vitamin D3 can affect the production and activity of several hormones like progesterone, estrogen, and testosterone. And we need optimal levels of vitamin D for autoimmunity. Vitamin D3 helps to inhibit Th17 cells, which are involved in autoimmunity. And the D3 also promotes regulatory T cells, which helps to suppress autoimmunity. Before you run out and buy some vitamin D, you really need to have your vitamin D levels tested. And unfortunately, most medical doctors, they don't test vitamin D. They don't see the importance of it. And not only that, conventional labs are so out of range and so out of touch with where healthy levels are that you're not going to be given the right information anyway. You are considered normal for vitamin D as long as you're over 30. Now, this level is just based on your bone health, not on optimal health. But as you can see on my chart here, you're deficient if you're under 25, you're insufficient between 25 and 50, you have adequate amounts, but I will tell you, you're still not going to feel really good at 50 to 75, and you're at optimum over 75. And as a functional medicine practitioner, we like to see you between 80 and 100 because that's where you're going to feel and function your best. So how do we optimize our vitamin D3 levels? Well, number one is safe sun exposure. And basically what that means is you got to be out in sunshine for at least 30 minutes every day. Now, even getting sunshine, it may not be enough because your body may not be able to convert that inactive D3 to the active D3. And that can be for a number of reasons. Number one, you might not have enough cholesterol to be able to do that. You might have poor gut health, poor liver or kidney health. You may be on certain medications that prevent the absorption of vitamin D. You may also be overweight, or if you're obese, that has an effect on how the body actually absorbs and utilizes vitamin D. Some other areas that we always want to assess when looking at vitamin D levels, it's not just supplementation, which is important if you need it, but dietary sources of vitamin D can come from things like fatty fish, like salmon, and egg yolks. So there are other areas where we can get that vitamin D, but again, if our body cannot convert it and or absorb it, we can still be deficient in vitamin D no matter how much we take. So we always need to make sure that we are assessing and addressing all factors related to vitamin D. Remember, optimal health is about understanding your body's needs. Vitamin D is just one piece of the puzzle, but it is an important one. I mean, if you're still struggling with anxiety, chronic fatigue, thyroid issues, hormone issues, autoimmunity, your vitamin D levels may be low. So if you're curious about your own vitamin D levels or want a comprehensive look at your health, don't forget to book a functional blood work evaluation with us. The link is in the description below. So thank you for tuning in to Decoding Health. Stay healthy, stay informed, and we'll see you in the next video.